Now we're to the COVID-19 update with Public Health Director Kathy McKay and staff.
Good morning, Mr. Chair and Commissioners. I did hand out the weekly data sheet that we provide. It is showing our positive cases in Clay County, 2,712. We have 46 deaths. Currently hospitalized, there's 12 from Clay County that are hospitalized and 3 that are currently in ICU. Our 14-day case rate per 10,000 is 82.96, so that has increased since our last 14-day case rate. And the numbers of, show you the trends on the second page where it shows the number of deaths. There's a little discrepancy. There's 46 deaths, but it only shows 45 in the last page as of October 28th, because we had another death in Clay County. So, and then 496 active cases still. On the third page, it has the same information. Minnesota positive cases are 153,620. That's cumulative. And the cumulative deaths are 2,484. The cumulative positivity rate was 5.3. However, the last 7-day positivity rate for Minnesota is 8.1%. And then you see the confirmed positive cases in the United States over the 9 million, 234, 856 deaths. And then globally, the 46 million. You'll see on the last page, we also added the Cass County data. As I had talked about last week, there's 1,371 active cases in Cass County. They have 87 deaths. Their total cases is 10,160. And their cumulative positivity rate has increased as well. It continues to rise, and that's 15.25%. Their 14-day case rate per 10,000, as you can see, is increasing, 111.40, and then the collection date of the October 19th through November is 137.56. So their numbers are continually on the rise. The Commissioner of Health had reported yesterday that we're still seeing increased cases. They're not necessarily linked to specific causes, but we're really seeing more community socialization, and then the transmission is coming from that, is the majority of the cases. So it's really all over our communities. Her takeaway was that Minnesota is still in a bad spot, and we really expect that this is going to continue, particularly in the next months where it's we see the temperatures drop again eventually, and we're going to see more people inside their homes, so less people outside. We just expect that the cases are going to increase, and we also have some major holidays coming up, so we expect that there's going to be more spread in that regard as people still want to get together in large groups. So any questions on some of the data I just presented?
Kathy, my question is, right now there's about 1,867 active cases in the Clay and Cass metro counties. And when we had 20 cases in Clay County in April and 40 cases in April, we really pumped the brakes in terms of what was in our control to help control the virus. And certainly I'm not advocating for closure of anything beyond our control, but what is Minnesota Department of Health advising counties and courthouses to do more of?
Well, and we still are in a locked, and I mean our door is open, but we have security at the Family Service Center building, also security at the courthouse. So we're only having limited customers into our building. So that's certainly one of their big recommendations. Also to as we look at what is the spread, what are we seeing? It's the majority are in community social activities, so we're not seeing the majority of that happening in the workplace. So that's also a factor. Still continuing to talk about masking, social distancing, that 15 minutes or less over a 24-hour period. So all of those measures are still in place. So just to continue to monitor that, that's the recommendation right now. We also are working with schools and higher ed, and their questions are also similar to when do we shut down and do total remote learning. And so we're working with the schools and the Minnesota Department of Health epidemiologists to determine a lot of the factors for schools at least. Is the spread happening in the schools, or is it mostly what we're seeing socially? And at this point, as our last meeting, most of the cases were from social gatherings. So the schools were technically still a safe place for those kids to be and for their staff to be. So when we see a significant uptick in numbers of spread in our facilities, I think that's where we take a hard look, and we're watching those numbers all the time. But currently right now, with the limited number of appointments that we're seeing face-to-face in all of our departments, that's really the recommendation, is try to avoid the face-to-face contact as much as possible. So we are doing that, of course, in public health, and I know social services as well, and many other departments are limiting only what is absolutely necessary. So that's the recommendation right now. And then we'll just be working with them on a weekly basis with our epidemiologists from the Minnesota Department of Health to make further recommendations for us.
And I appreciate that. There still is 25% that's unknown or missing as to what the likely exposure is. And so, yes, there is social spread happening. But there's also a quarter we don't know about.
Right, exactly, yep. And when we anticipate it's going to get worse, so we're not gonna see an improvement is what they are stating, Minnesota Department of Health and the Commissioner of Health, because they know that, again, the season that we're in, we also have influenza right around the corner, so we're anticipating it to be significantly worse with 2 viruses circulating. And potentially no COVID vaccine in the next month or 2 that will be able to get out to the public. So that's the concern, and so the caution to everyone is really the masking, and then staying away from large crowds, large gatherings of 10 or less is recommended right now, and continue to do your hand hygiene and just to stay home when you're sick. If you have any symptoms, we really recommend you stay home. And then, of course, Jamie will get into the testing piece as well, and some of the information she'll share is common questions that we continue to hear as people are confused about what they should do, if they're symptomatic or not symptomatic, et cetera. So,
I have one final, Mr. Chair, if I may. Sure. In terms of staff and keeping staff safe, I know we've had some staff exposures, and is it the policy now to encourage, are there any more people we can encourage to work remotely? And then my second question is, at what point do we require the majority of our face-to-face meetings to happen virtually?
And our policy still is the remote work, if you can do that in every department. And I know that we've talked about that in county management as well, that the policy hasn't changed about encouraging and actually advising remote work. There's some people that cannot do that because they would have no work to do remotely, but for the majority of people, that is still our recommendation.
Thanks.
Does that answer that, Commissioner Mojo?
Right.
Okay, thank you.
Jamie?
Okay, I'm going to talk a little bit about testing. Last Wednesday, the Minnesota Department of Health provided some guidance on home testing. And so, as you are aware, we have a saliva testing site in Moorhead, but some of our neighboring counties have the ability to have an at-home saliva test. And the comment from the Minnesota Department of Health is at-home saliva testing will soon be available to all Minnesotans. And so that is the push. Right now, Otter Tail County, Becker County have the ability to order a home saliva test kit. The focus on community spread is really about we need to be testing and we need to quickly isolate and quarantine people. So that is the effort that's happening right now. Just to give you a little bit of information on what happened at our saliva testing site last week. The week of October 25th, we tested 2,875 people. The week before, there was over 1,000. And the overall positivity rate at that site continues to run an average above 20%. And there's roughly an even number between people from Minnesota and North Dakota being tested. So it continues to go very well, and we're thankful for having that as an opportunity. For people that, I just want to talk a little bit again about isolation, quarantine, contacts, and to clear up any confusion over that. Anyone who has symptoms, and symptoms can be so vague, people will say, I thought I had a cold, I just minor kinds of things, but anyone who has symptoms should stay home and get tested because we have the ability to have testing available to us. If you were tested because you were in contact with someone who has COVID and you do not have symptoms, you still need to remain quarantined for 14 days. You can be tested, however, you still need to remain home for 14 days. And there's some confusion about that. Basically, in order to know what we are dealing with, because there are asymptomatic people in the community, they do recommend that you get tested at day 5 to 7. But again, it does not release you from quarantine. There are certain circumstances, typically it is congregate living settings, so our long-term care facilities, our correctional facilities, any type of a congregate care setting, that when a person is quarantined, even if they were tested early, that they consider a test at day 12 before going back into the workplace. So you're a close contact in the community or in a congregate care setting. They recommend that you get tested when you're quarantined, day 5 to 7. That only gives you an answer of whether you're positive that day. Now, when you get close to day 14, when you could go back into the workforce, they recommend that you get tested on day 12, because if you get your test results within 2 days, day 14, you are negative and good to go into the community. That's as close as they can get it in that scenario. If you ended up testing positive in that and you still have no symptoms, then you are considered infectious. So then you would not be going back into the work setting. And so that's the concern about we're releasing too soon. There are exceptions to that, and the exceptions have to do with critical workforce. In a critical workforce situation, they may release someone day 10 into the workforce with making sure that they're wearing masks, they're separating from others, and not, as much as possible, not caring for the public if possible. In that case, they do recommend that they're testing again as well. And just to address some of the asymptomatic people with known COVID exposure, the following groups are considered high priority for testing. So they're an asymptomatic person with a known COVID exposure, and that would be individuals who are working or attending a K-12 or child care center, hospitalized patients, healthcare personnel, first responders, individuals living, working, or visiting congregate care settings, individuals with medical conditions including pregnancy, individuals 65 years of age or older, individuals who live in households with a high-risk individual or who provide care in a household with a high-risk individual, and members of a large household living in close quarters. And so again, I want to just repeat that those are people that would be asymptomatic people with a known exposure, and there's a high consideration for having them tested. Repeat testing at the end of the quarantine period may be recommended, as I mentioned, in congregate care settings. And let's see. And again, just to clarify the difference between isolation, a person who is sick is isolated from others because they have symptoms for 10 days. If that 10-day period happens and they are continuing to have a fever, they should continue to stay home. A person who is quarantined is a person who has been exposed to someone known to have COVID, and that person is separating from others for 14 days because that is the period of time that they could potentially develop symptoms. So day 1 to day 14 is when they could develop those symptoms. That's why testing on day 5 or 7 doesn't release them from that 14 days of quarantine because they could develop symptoms. And that's it.
Do you want to talk about the positive isolation? Or do you want me to do that? So those that are positive, and Jamie talked about those are the ones in isolation. So if you're positive, then you do stay home for the 10 days. At that 10-day point, if you weren't hospitalized or you're not still having a fever or other symptoms, you can return to your workplace or school. There is no recommendation to retest you. So on day 10, the virus load has diminished over those 10 days. So even if you have some symptoms still, there are times where people have lingering symptoms, and some people have lingering symptoms for months after they've had a COVID positive case. But there is no repeat testing. The CDC says that after the 10 days, there is no transmission potential for that. So businesses and others cannot require a second test. It may be positive, but if you have lingering symptoms still, but you don't have enough to be infectious to others. So that 10-day period for positive cases that's the end of that. That is different than what Jamie was talking about with the quarantine. So it's confusing. We do this every day, so I understand that this can be confusing. That's why we get a lot of questions, and a lot of people have questions about the differences between quarantine, isolation, the dates, when do I get tested, when do you not recommend testing. So we're happy to field all those questions. We work through this on a regular basis. Our case investigators and contact tracers are also providing a lot of that information to the folks that they're working with.
Sorry, Kathy, I forgot that. There is information on the CDC website dated October 27th that addresses reinfection of COVID, and as you know, they're continuing to study that. But at this point, according to the CDC, if you test positive, you do not need to repeat test for at least 3 months. And that is because of the fact that they know that you could possibly still test positive, but you are not infectious after that 10-day period of time.
Any other questions for us? Okay. Thank you very much.
Thank you.
Thank you.